Perfect. So welcome everybody. I'd like to start the formal part of our program today with our land acknowledgement. We would like to begin by acknowledging that the lands on which we live and gather are the appropriated homelands of Indigenous peoples. We want to express our deepest respect to those peoples past and present for their care of these lands throughout the generations. That is a shortened version. The very first time we did the program, I read the longer version, but you can learn more about the land acknowledgement and why we do those on the library's website as well. So I'd like to introduce Ellen, who is coming in as my tech support person on this intentional aging program going forward. And I'm excited to see Adele, who many of you have seen at previous ones. Adele was able to join the world of the retired and is no longer having to be tech support and gets to come in and participate. So I'm excited to have her here as well. So that is great. So before, let's see, the next couple of months, we have presenters this month, and then we have a special date on March 1st. You do not have to register for it, but if you want a reminder, go in and follow the link. I will still send out my email that has the Zoom link in it. It is the same link. And the one on March 1st will be at the same time, 11 to 12:30. And it'll be 2 graduate students from the University of Washington. And thank you to those that were able to follow their Google link. They had a Google survey where they were kind of asking questions about areas of interest regarding nutrition. And so they'll be coming on March 1st. And then March 15th, I've got Katie Bowman coming in talking about dynamic aging and movement specifically. So those are the next couple coming up. And again, you only have to register once. I'm having some issues with the linked programs where in order to cancel, I have to remove earlier programs. And somebody sent me something that the reminder, the automated reminder, showed like an October date on it. So please look for the one from me to confirm that date and time on those. I'm trying to figure out the best way to have this program in that system. So if I make changes to that, I will let you guys know. And I apologize for any confusion that happened there.
And we do have a question in the chat.
Yeah.
Saying, can we go ahead and ask questions for the SHIBA speaker?
We will in just a moment. So let me grab. Okay. So what we're going to do today is we have Eva Bennet, and Eva is, bring my notes back. Eva Bennet is the Statewide Health Insurance Benefits Advisor, and the acronym for that is SHIBA. She's the volunteer coordinator for the Olympic Area Agency on Aging, and she is here today to provide an introduction to the SHIBA program. SHIBA volunteers provide free, unbiased, and confidential help with Medicare and related healthcare choices to people of all ages and backgrounds. And I understand as part of our program, there's a little focus on the wellness benefit, the wellness visit that you have every year. But also opportunities to ask questions. Eva is planning to pause during her presentation to give a Q&A opportunity. If you do not wish to be in the recording, this is when you can turn your camera off if you'd like to. You can also use the chat for questions, but feel free, if you're comfortable with it, to just unmute, raise your hand, ask a question, and she'll kind of prompt at those pauses of when that works. At the end, there will, of course, also be another Q&A window. And if you have something that you don't want to be part of the recording, you can, of course, save that for the end, and you'll have an opportunity there to ask those questions as well. So without further ado, I'd like to get started and introduce Eva Bennet. And first of all, thank you for your time and coming in here. And being available to everybody. I think this is great, and I'm really excited to connect all of you with the resources that we have through Eva Bennet and the O3A organization on the peninsula. So I will hand it over.
I am delighted to be here because sharing this information is important, and I'm hoping that you will feel free to share it across your friend group and anybody professionally that you're involved with, because there's a lot of valuable information for us that helps improve our lives. I should introduce myself in a little bit more depth. I am Eva Bennet. I am, as Cheryl said, the SHIBA volunteer coordinator for Jefferson and Clallam counties specifically that are part of the Olympic Area Agency on Aging. It's known as O3A if you're not aware of the agency. The reason I'm specific about Jefferson and Clallam counties is that Olympic Area Agency on Aging also covers Pacific and Grays Harbor. I am not the volunteer coordinator for those two counties, although we do provide SHIBA services there that are the same as what we provide here in Jefferson and Clallam. I retired, and I came out of retirement to be a SHIBA volunteer. And because SHIBA volunteering is not unlike having a job. So I was a SHIBA volunteer for 7 years. And then I took the job as the coordinator about a year ago. So clearly I love this program. And what I want to do now is, I'm going to be a little bit awkward here. I'm going to be shifting back and forth between screens. So just bear with me with my inaptitude with technology for a minute here. Okay, can everybody see this cover? Uh-oh, I'm flying through the slides. Can everybody see the screen, the presentation cover that says Medicare Preventive Benefits?
Yes.
Looks good.
Yep.
So Cheryl mentioned this, but I want to be a little bit more specific. Today, we're going to talk about what SHIBA is in some detail. And we're going to talk also about Medicare. That will be necessarily some basics about Medicare. We just don't have the time for me to get into it in detail today. And we're going to be focusing mostly on preventive benefits, because I believe that those benefits are of tremendous value to us all, as I mentioned earlier. And of those preventive benefits, I want to spend a little bit more time on wellness visits. There's an annual wellness visit and there's an initial wellness visit when you join Medicare Part B. And then, of course, I want to mention that we've got help programs available to help people pay for Medicare. So what's SHIBA? SHIBA, as Cheryl said, stands for Statewide Health Insurance Benefits Advisors. It's a national program. It's all across the United States. And nationally, it's called SHIP, which means State Health Insurance Advisory Program. That is what CMS, the Centers for Medicare and Medicaid Services, calls the program and organizes the program. The program is organized within CMS and other HHS departments. Our purpose at SHIBA is to provide unbiased and confidential information about Medicare specifically, and then also related health insurance that goes along with Medicare. We are a volunteer-driven group, and we want you to be able to navigate Medicare. So we're an educational group primarily. We want to give you the information you need to make the best decisions that you can. Our help is provided one-on-one, and we don't sell anything. We have absolutely nothing to sell. So we're completely unbiased. And we're here, as I mentioned earlier, we're part of the Olympic Area Agency on Aging. We're a program of that agency. And more importantly, I think, we are a program of the Office of Insurance Commissioner of the State of Washington's Consumer Protection Program. So this is all about protecting you from problems with your Medicare insurance.
Jeff Walker.
Okay. I mentioned that we are a volunteer-driven program. All of our volunteers have a federal background check, a US-wide background check before they can become volunteers. Then we get trained, then we're certified by taking a test, and then every single month we get further training. So as close to an expert about Medicare that you can get, that's us. In both Jefferson and Clallam counties, we provide our services through walk-in clinics. So first come, first serve, we're open for a certain number of hours in several locations, and you just walk on in and we're there to help. Those walk-in clinics in Jefferson County are, I'm going to read this so that you have time to document it if you'd like, are the first and third Tuesdays at the Port Townsend Senior Center from 1 to 3 p.m., the second and fourth Tuesdays at the Tri-Area Community Center in Chimacum from 10 to noon. And on the fourth Wednesday, we're in Quilcene from 10 to 1. In Clallam, we do something very similar. Our first and third Tuesdays are at the Shipley Center in Sequim from 10 to noon. Then we're in the Port Angeles Senior Center from 10 to noon on the second and fourth Friday. Finally, in Forks, we ask that you call, and that number is 360-374-9496. Now, all of our volunteers are vaccinated and we wear masks at the clinics. We ask that you also wear a mask and are vaccinated when you come to a clinic. However, if you are unable to do that, we do have limited phone support, so we can provide you one-on-one counseling by telephone. And the phone number to call for that is, and this should say 800, sorry about that. It's an 800 number, 800-562-6900. So cross out the 360. It's 800-562-6900. So I'm going to exit this and I'm going to ask you for your questions about SHIBA. Does anyone have any questions about SHIBA?
Yeah, can I have the Forks number again?
Sure. It is, hold on. I have to go back to the screen, so bear with me. I don't have it memorized. It is 360.
No, 800.
No. The Forks number is 360.
Oh, the Forks.
Yeah, 374-9496, extension 2.
I've also added that and the 800 number into the chat.
I have a question.
Yes, ma'am.
What should we bring to the appointment? I mean, anything that says Medicare on it, but
Yeah, it depends on what you want, but generally we want to see what your prescriptions are, the dosages, and how often you take them. We want to see your Medicare card. And we're going to talk about this in a minute. We want to see your Medicare Advantage card if you do have a Medicare Advantage program. And letters that you've gotten from DSHS or Social Security that relate to your medical insurance and medical coverage. And if you've got anything from Medicare, of course, we'd like to see that as well.
Thank you.
Now, I want to add one thing to that. A lot of people are getting a lot of mail right now about Medicare, and mostly that mail is about Medicare Advantage plans. If you're questioning that mail and its accuracy and its validity, please bring it in. You don't have to save it if you know that it's an ad, but if you do have any questions, bring it in and we can answer those questions for you.
Eva,
Yes.
are you familiar with the health sharing plans and how they might work to use as a Medicare supplemental?
There are two questions in that, Tammy. Medicare supplements are a certain kind of insurance with Medicare, and I'm going to talk about that in a minute. Health sharing, I don't understand. I don't know what that is.
You've heard of the Christian health sharing plans, right?
Right, I have.
Okay.
Yeah.
Okay.
Those are actually not insurance.
Right.
So in terms of the parts of Medicare, you know what, I'm going to talk about Medicare for a few minutes after this question session. And what I'd like you to do is
Hold.
go through that section and see if you still have the question after we've gone through that.
Okay.
Is that okay? Okay.
That's fine. Thank you.
Sure. Does anybody else?
Beverly dropped in. I think you may be getting to this, is how do we schedule our free annual wellness checkup?
I'm gonna get that.
Hop into
Get to
that one.
that. And if I don't address it directly, please remind me after we do the preventive services section.
And for those that are interested, I'll do a little research and come back maybe at the next time we meet about what health sharing plans are. I understand them as kind of subscription-based services. The one I'm aware of was a neighbor of mine is an RN, and that's the type of place that she worked. People paid a monthly amount to have access to their doctors and care providers, as I understand it, on a very basic level. But I'll try and do a little more for anybody who's interested in that information. So
I
Are
think
there any-
there's another type, Cheryl. We could talk about that later, though.
Any other questions about SHIBA?
Can you help me figure out, could SHIBA help me figure out Medicare and Medicaid working together?
Absolutely.
That will bring me into the clinic for sure, because I don't understand it.
Yeah, that definitely is something that we address.
Okay. I'll probably be seeing you in Port Angeles.
Okay, I'm going to go back to screen sharing. I hope I'm sharing the right screen. Let me do this. So having said that about SHIBA, are you interested in volunteering? It's a great volunteer job. It's one of the hardest ever, but it is a great, great volunteer opportunity. And I understand that volunteering is one of the things that helps us in our aging process. I know it has helped me immensely to be a volunteer, to continue to feel like I'm contributing, I'm active, all of those good things. If you know somebody or if you yourself are interested in volunteering, please call 360-417-8555. And we'd like our volunteers to be passionate about helping people, just love helping people, We want people to be computer friendly, don't have to be an expert, but to be comfortable with computing. And finally, be willing to work as a team and as part of a team. So let's talk about Medicare. It is medical insurance. So just like you had when you were working, you might have had a group health plan of some sort, and that was your health insurance, or you bought privately on the exchange, that was your health insurance. Medicare is health insurance, and it's for people who are 65 or over. It's also for disabled people. Cheryl has a book about Social Security and disability. Medicare is available to those who have been disabled for 24 months by Social Security. Those who have end-stage renal disease and Lou Gehrig's disease also are Medicare enrollees. And the big qualification for Medicare that stops some people from being eligible is you must be a legal permanent resident for at least 5 continuous years. So let's go to the Medicare Is Insurance part. There are 4 parts to Medicare. Part A is hospital insurance. That's when you're actually admitted to the hospital as an inpatient. There's a difference between being an inpatient and being a patient who's under observation in the hospital. So be aware that Part A is for when you are in the hospital as an inpatient. Part B is medical insurance. That's when you go to see your medical provider, your doctor or your PA. Parts A and B comprise original Medicare. In 1965, Johnson and that administration instituted Medicare as a benefit for us all. So that's why Part A and Part B are called original Medicare. Part D, which is coverage for your prescriptions, was added in 2006 and is now part of the original Medicare side of the chart. And I'll show you the chart soon, but really original Medicare you can think of as A and B, and Part D is an add-on. Part C is a different way of getting your Medicare coverage, and they're also called Medicare Advantage plans. So it's not just Part C. They were introduced in 1999. They are group or HMO type plans. Part C Medicare Advantage plans are, and they're sold by private insurers. They include original Medicare benefits, plus they may include prescription drug insurance and other benefits that are beyond original Medicare. So here's a nifty little chart that describes how you can get your Medicare coverage. You get original Medicare with Part A and Part B. You then can decide whether you want prescription drug coverage if you have Part A and or B. And then you can get a Medicare supplement that supplements Part A and B. Those are also known as Medigaps. Another way of getting your Medicare coverage is through Part C, as I said earlier, a Medicare Advantage plan. It combines often prescription drug coverage, and it requires that you have both Part A and Part B. So in order to enroll in Part C, you must have Part A and Part B. In addition, in order to enroll in a supplement or a Medigap plan, you must have both Parts A and Part B. here's a little bit of specifics about what Part A and Part B cover. So Part A, as I said earlier, is hospital insurance. Again, that's when you're an inpatient, not when you're under observation status. Even though you feel when you're in observation that you're in the hospital as an inpatient, you're coded differently than when you're an inpatient, and your coverage comes under a different part of Medicare. It also covers a skilled nursing facility services. This becomes important. This makes the hospital insurance, inpatient insurance, very important. If you haven't been an inpatient for 3 days, then you do not have Medicare paying for the skilled nursing facility. If you have been an inpatient for 3 days, you do get the skilled nursing facility paid for if it's considered medically necessary. In addition, Medicare Part A covers home health and hospice care. Let me give you a personal example of Part A insurance. This is what happened to me. I had major back surgery in July. I was an inpatient for about 7 to 10 days. It was major surgery. Because I had been in the hospital for more than 3 days as an inpatient, and because it was medically necessary, I was sent to a skilled nursing facility for about 2 more weeks or 3 weeks, where I was given physical therapy, occupational therapy, and sort of brought back to myself through the services of the skilled nursing facility. Once I got home, I was still housebound, and I still needed physical therapy, occupational therapy, and a little bit of nursing care. So because it was medically necessary and because I was housebound, I got home health care to come into my home for, I'd say, 3 or 4 more weeks. Part B is medical insurance. It includes doctor's visits or your provider visits. So it doesn't have to be an MD. It could be a doctor of, what is the other kind of doctor? I'm forgetting the term right now, but it encompasses all medical providers. It also includes.
It's a DO, Eva, it's a DO, Doctor of Osteopathy.
There you go. Thank you. Thank you. So if you didn't hear that, it's an osteopath that I was thinking of. I was also thinking of PAs, physician's assistants. So your visits to the provider are covered under Part B. Outpatient hospital services are under Part B. So if you have outpatient surgery, for example, and you haven't been admitted, that would be covered under Part B. Lab tests, durable medical equipment, and importantly, preventative services are all covered under Part B. As an aside, I don't know if you're aware, but preventive and preventative mean exactly the same thing. And I tend to say preventative rather than preventive, but they're exactly the same thing. So what are the costs for Medicare? Most of us pay nothing for our Part A coverage. That's because we paid for it through our FICA taxes for the whole 10 years that we worked. We have to have worked for 10 years in order to get a zero premium for Part A. Part B this year in 2022, for most of us again, has a premium of $170.10 per month. There is an annual deductible for Part B, which is $233. With Part B, you're going to be paying 20% of your assigned amount. Plus, in certain circumstances, there's something called a limiting amount for provider visits. There are certain providers who can charge more than the agreed upon Medicare amount. And that additional amount is called a limiting amount. They're limited in the state of Washington to being able to charge 15% more than the assigned amount for Medicare. For Part A, there's a deductible per benefit period of $1,556. And if you choose a Medicare Advantage plan, you're going to be paying a premium in most cases here on the North Olympic Peninsula. And if you choose to be with Original Medicare and still want a Part D plan and or a Medigap plan, you're going to be paying premiums for the Medigap or the Part D plan. So, questions about Medicare?
I have a question. Can you move back and forth from straight Medicare to Medigap plans and then back again if you decide you want to?
So if you have a Medigap plan, that means that you're on Original Medicare. And once you're on a Medigap plan, if you enrolled during your initial, what's called your initial enrollment period, or during a special enrollment period, you didn't have a health screen in order to enroll. In other words, you had a guaranteed issue to enroll in that Medigap. Once you've enrolled and you keep your Medigap for at least 3 months, you can switch to any other Medigap that's offered in the state of Washington, except a Plan A. And I'm not going to get into detail today about all the Medigap plans, but trust me, there are a lot of them. If you chose to get a Medicare Advantage plan, and this is the first time you've had a Medicare Advantage plan, you have a year in which to change your mind and move to a Medigap. If you were on a Medigap and want to change to a Medicare Advantage plan, and again, it's your first year ever being on a Medicare Advantage plan, you have the first year in which you can change your mind and move back to the Medigap that you had and move back to Original Medicare.
Yikes.
Yeah. Yeah. So
Ah,
that's a perfect reason for coming to a clinic, because if you're interested in moving, there's a lot more detail that's involved and we can talk through it with you.
okay.
I have a question also regarding that. If it's a Med Advantage plan, which is what I've been on for a couple of years, then what would be the advantage of going back to Original Medicare with a Medigap plan?
It depends on how you use the medical system. And I think that the more traditionally you used it, you're probably, well, I don't know, that may not be a fair way to say this. Medigaps pay all or some of the gaps left by Medicare, Original Medicare. So, for example, there's that 20% copay for your Part B for your doctor visits. Most of the Medicare supplement plans will pay that 20%. When you have a Medicare Advantage plan, you're paying as you go. You're paying some copays and deductibles every time you see a doctor, every time you're in the hospital. So the Medigap fills those gaps. The Medicare Advantage plan has copays, coinsurance, and, well, it won't have other deductibles, but it'll have coinsurance and copays. In addition, the Medicare Advantage plan does have coverage, some coverage for things that Medicare doesn't cover at all, and Medicare supplements don't cover at all. The Medicare Advantage plans will often have some dental coverage, basic dental, and some basic vision, maybe a gym membership. Those are the standard Medicare Advantage plans. There are other kinds of Medicare Advantage plans that I don't want to get into detail about here, but they're for people who are in very limited income situations. So some people want to have a Medigap because they don't want to be paying on the way, and they're not going to have much in terms of dental or vision expenses. And so the Medigap covers their expenses. Some people want a Medicare Advantage plan because they want that little bit of dental and vision coverage. They want a gym membership, and they don't mind paying as they go for copays and coinsurance. It's a very hard comparison to make. And there is a document at oic.wa.gov. And I saw that Cheryl posted that website, oic.wa.gov. And on that website, under their Medicare section, there is a document that describes the difference between Medicare Advantage plans and Medigaps specifically. And it would explain in detail why you would want to switch one way or another.
I understand, though, that you have to have a medical exam if you change from Med Advantage back to original Medicare.
It depends.
Okay.
You do it, and it's not a medical exam, it's a health screen. A health screen is just a questionnaire. But it depends on when you do it. You see, the timing is all.
Yeah, thank you.
You're welcome. Anybody else about Medicare? I know I just gave you an overview. If you need more detail, come to a clinic, we can give you more detail. Also, you can read on oic.wa.gov plenty of information about Medicare. And the ultimate website is medicare.gov. That is all things Medicare. So I'm going to go back and we're going to talk about preventive benefits now.
Before you move into that, I wanted to mention that middle link that I posted, I believe has the Medicare link on it. And there's a whole, they have a Medicaid link on that one, but there's a whole slew of state resources on that one. And I'll get the Medicare one linked into the chat as well.
Medicaid, I would like to add something to that, Cheryl. Medicaid works with Medicare differently than it works before you're on Medicare, because Medicare is the primary payer. When you're under 65 and not on Medicare and are on Medicaid, which is also known as Apple Health, then your expenses are being picked up by Medicaid and shared with the feds. So why preventive services? Obviously, the idea is to prevent illness, to detect medical conditions that might be affecting your health, and of course, to keep you healthy. Part B, the medical insurance that we talked about earlier, covers preventative services. Preventative services include screenings, things like cardiovascular screenings, colorectal cancer screenings, and I'll show you a full list in a minute. It'll cover certain vaccines. Some vaccines are covered under Part D, as in David, your prescription drug coverage, but most of them, the standard ones, are covered under Part B, and some counseling, intensive behavioral counseling. The US Preventative Services Task Force, anything that's recommended by them is covered by Medicare Part B 100%. But note that every service, every preventive service has its own eligibility requirements. So I'll be a little silly here. A woman is not going to be eligible for a prostate exam or screening. A man is not going to be eligible for a PAP exam or screening. There are also timing guidelines with every preventive service that's offered by Medicare. I'll show you some detail about that so that you see what I mean. If you have a non-participating or opt-out provider, you're now in a situation where you're going to be paying more for your coverage for preventive services than you would otherwise with a participating provider. A non-participating provider is one who, for certain services, has decided to charge up to 15% more for a Medicare service. As I said earlier, that 15% more is called a limiting charge, and you would be responsible for that up to 15%. The rest would be paid by Medicare, but that limiting amount would be paid out of your pocket. An opt-out provider is one who doesn't accept Medicare, so that is entirely out of your pocket. During your service, during a screening, if your provider gets into diagnostic processes at all, or starts discussing specific conditions with you and starts doing hands-on medical work with you, then you're going to be charged as if this is a standard office visit. It steps out of the wellness and preventive, it steps out of the preventive services world and steps into normal office visits. So if you get other services during a screening, all of a sudden you're going to have to pay 20% for that visit. If you have a Medicare supplement plan that covers that 20%, you're not going to feel it. If you have a Medicare Advantage plan, you may have a copay that you have to pay. Otherwise, it's covered 100% by Medicare. This is a list of all of the services, preventive services offered by Medicare. So you can see there's counseling, intensive behavioral counseling to prevent tobacco use, diabetes self-management training, hepatitis C screening. Here are some vaccines, flu shots, hepatitis, pap tests, prostate screenings. And there's also a one-time initial wellness visit, which I'm going to spend a little bit more time talking about, and a yearly wellness visit. So there's a plethora here of services that you can take advantage of. We're going to look at some of those in detail right now. So here goes with sharing the screen again. Can you see something that says preventive and screening services?
We're still seeing your slide deck.
Okay.
So you may have to reinitiate the share.
Okay, here we go.
Perfect.
So this is at a specific URL, and I'll give you that URL in a minute. This is from Medicare.gov, and they have a full list of their services, preventive services, at this site. Now, why is this useful? It's useful for you to know what services are available And let's take cardiovascular disease behavioral counseling as a service. So this tells me that Medicare Part B covers cardiovascular behavioral therapy one time each year with your primary or somebody in your primary's office who's qualified to provide this service. Tells you how much you have to pay. In this case, you have to pay nothing if you meet those qualification requirements. Now, specifically, what is it? During the therapy, you may discuss aspirin use, check your blood pressure, and give you tips on eating well. So the detail about the preventive services here, let's go to abdominal aortic aneurysm screenings. If you're at risk, you get ultrasound screening, ultrasound once, and you're considered to be at risk if your family has a history or you're a man who's 65 to 75 and have smoked at least 100 cigarettes in your life. You get it once in a life. And again, you're not going to pay anything out of pocket. Medicare Part B is going to pay for this, assuming that your provider accepts assignment. That is not a non-participating or opt-out provider. I'm curious about depression screenings. It's one depression screening per year, and you may get referred for more than one a year. And the provider may recommend services that are not covered by this particular preventive service. And in that case, you're going to have to pay some or all of the costs. And the screening has to, again, be done in your primary doctor's office. And make sure that that provider can provide follow-up treatment and referrals if necessary. So shots, vaccine, pneumonia vaccines. I didn't know this. Medicare Part B covers 2 different pneumococcal shots. Part B covers the first shot, and at any time, and a different second shot if it's given at least 1 year after the first shot. And you don't pay for it as long as it's done by a qualified health practitioner who accepts assignment for giving the shots. So interestingly, the supermarkets, or at least some of the supermarkets and pharmacies, will deliver those shots to you and not charge you anything, because Part B is paying for that shot, that vaccination. And they give you a definition of what that is. What is a pneumonia vaccine? So now I want to go, actually, should I allow for questions now? No, I'm going to go to talking about the annual wellness visit and the yearly wellness visit, and then I'll stop for questions again. So the URL where I was looking for the last few minutes that had that list of all of the preventive services offered by Medicare is here.
I did drop it in the chat as well.
Okay.
And I'll share all those links in the
Right.
follow-up email I'll send out.
Now, there are lots of sites for preventive services. I think the most useful one is a document that is out of CMS, Centers for Medicare and Medicaid Services, and that document is numbered 10110. It is actually a Medicare Preventive Services pamphlet that tells you all there is to know about preventive services. You can get it online at this website, or you can order it directly from CMS. CMS allows us as members of the public to access these books that they print. That's who they're for. I mentioned the U.S. Preventive Services Task Force earlier. It is an independent task force that identifies preventive services and recommends them to Medicare and health insurance providers to get them to offer those preventive services. So this is more information about that task force. And above, the first one that's listed here is very similar to the site we were looking at in that it lists all of the preventive services of Medicare. The difference with this one versus the one we were looking at is that it gives information to the provider about that preventive services. So if you're interested in what the provider has to do, that's at the URL that's at the top of this page. So let's talk about your first wellness exam. Remember, I mentioned that that is one of your preventive services, and it's probably one of the most important of them. In the first 12 months that you have Part B, you're encouraged to meet with your provider to develop a personal prevention plan. This isn't a physical. If your provider finds something that needs to be investigated, that's considered diagnostic, and you will end up cost sharing. It'll become an office visit, and you'll owe 20% of that visit. That 20% again might be covered by your Medicare supplement plan, and you might have a copay if you have a Medicare Advantage plan. But if you don't get into the diagnostics, then you will owe nothing because the preventive visit and the wellness visit is covered by Medicare Part B. During your initial wellness visit, you're going to have your height, weight, blood pressure, and other measurements taken. There's going to be a health risk assessment. This word should say vaccinations. The provider will possibly administer some vaccinations like the pneumonia shot. As an aside, the shingles shot is not covered by Part B. It's covered by Part D, prescription drug coverage. So the price for that, the cost for you for that depends on your Part D plan. The provider is going to look at your functional ability and how safe you are. They're going to want to learn about your medical history, both yours and that of your family. You're going to, as an output from this visit, you're going to get a 5 to 10 year screening schedule. So all those screenings that were listed, you're going to get a schedule for those screenings and possibly more, depending on your particular situation. And I find this very interesting. They do a screening for cognitive impairment and depression. I did not know that. And they'll provide health advice and referrals. Now, it's important for you to understand that this is not a physical. I'm sorry, I'm going to go back for a minute. This is not a physical. That means that it's not particularly hands-on. Yeah, when they take your blood pressure, they're hands-on, but it's not a hands-on head-to-toe physical like we think of as an annual checkup. It's not. Medicare does not cover annual physicals. However, it does cover this first wellness visit and then subsequent annual wellness visits. Remember that this first wellness visit is within the first 12 months that you have Part B. B as in baby. Annually, after you've had your first wellness visit, every 12 months after that, you can have an annual visit. And it's very similar to the first wellness visit that you've had. Again, it's not a physical. And if the your provider needs to treat or investigate something beyond the wellness visit, that'll become diagnostic, and that becomes an office visit. So in my view, the best way to treat these wellness visits is by having the provider lead you. Just when you're making the appointment, you're asking for a wellness visit, and the provider is then prepared to go through their checklist with you. If you're wondering about whether something is part of the wellness visit that you want to talk about, ask your provider and he or she will say yes or no, so that you can avoid making this a standard office visit if you want to avoid that cost. I keep reminding you, because a lot of people are confused by this. If your wellness visit strays beyond the parameters of, as defined by Medicare, of a wellness visit, you may end up in a normal office visit where a copayment or deductible expense occurs. Here's what happens during an annual wellness visit. You get a risk assessment. You again review, this is not the initial discussion of medical and family history. This is a review of it. Your height, weight, and blood pressure are going to be checked. There will be advanced care planning. I'm sure you've been given forms by your providers for advanced care planning. That 5 to 10 year health screening checklist gets updated during an annual wellness visit. And the provider's going to check through your medications and make sure that they have a current list. And again, we'll be checking for cognitive impairment. So are there any questions about preventive benefits?
I don't know if this is a question, but it's more of a concern, is that when you go in for an annual wellness visit, if the MA that, takes you in and does all the initial getting you set up, and the physician are not all on the same page, and the scheduler, if it isn't in neon letters, this is an annual wellness visit, they're just going to do the stuff they do, not necessarily paying attention to what you want to pay for or not. It's a lot of controlling by the patient, and I don't know how to
make
do
the
that.
appointment. You need to be clear that this is your annual wellness visit or your initial wellness visit, because they set up for those visits differently than if it's just a regular diagnostic check or a regular office visit with your provider. So you have to explicitly state that it is a wellness visit, and they'll be prepared. And let them, again, as I said earlier, they will lead you through it because they know the differences in terms of costs to you and want to make sure that you don't accrue costs that you don't expect.
I have a question.
Sure.
What if what if you didn't get your initial wellness visit within 12 months of getting Part B?
Then what happens is you go into your annual wellness visits. I did that. So I
'Cause
ended up.
I don't know if I had one or not.
Right, right, right. And I did it by mistake. I had no
You
idea.
did? Okay.
And then I just get annual ones now.
Okay, cool. Thank you.
Mhm.
So I had a question. So if you go in for the wellness visit and the doctor orders like a yearly blood workup for cholesterol and that type of thing, then that goes outside the perimeter of a wellness visit?
I don't know the answer to that. You will have to ask your provider. I think that it does. And that what happens is you're getting a checklist of what needs to be done and go for an office visit where the provider then says, okay, we do need to do this blood test because we're looking at whether you have diabetes, or we're looking at general cholesterol, all of the things that they do complete blood counts for. So I think that that is outside the parameters of an annual wellness visit. But I do find, I could very well be wrong about that. And I'm not certain, because I do find that my provider basically calls me in every year to say it's time for your annual blood test. So I don't pay anything for those visits. So possibly they are included. You'll have to ask your provider. They'll know precisely what they can and cannot do.
Okay, thank you.
Sorry. Okay, so I'm gonna go back to screen sharing and we're gonna go to our,
Evan, before you move on, we do have a question in the chat. What if I have had Medicare Advantage plan for over a year and did not get a wellness visit? So,
you'll be then in the annual wellness visit world.
so they could just call and schedule with
An
their
annual
provider at
wellness,
this time.
Yeah. Were there any other questions?
That was the only one that was dropped there. Yeah.
Okay, so this is the last section. I wanted to talk about the costs of preventive services. We've actually already talked about the costs, so I am going to go to the costs of Medicare generally and how you can get help paying those costs. There's something called Medicare Savings programs. They are programs where you get help from Medicaid to pay the Medicare costs. They may pay your Medicare premiums, or they may also pay your deductibles and co-insurance for Medicare. The income and resource levels that qualify you change every year and do go up every year. So the reason to be aware of that is that if you are spending down your resources or your assets, you may qualify after you've spent them down to the level that Medicare requires for an MSP. So be aware of the numbers because you may eventually qualify. Here are some of the specific numbers for a Medicare Savings program. The most comprehensive coverage comes from something called a Qualified Medicare Beneficiary Medicare Savings Program, also known as QIMBY. Your income limit as an individual to qualify for QIMBY is $1,153 per month. If you're married, then it's $1,546. Let me make that bigger. SLIMB, Specified Low Income Medicare Beneficiary, has higher income limits of $1,379 if you're an individual, or 1851 if you're a married couple. SLIMB pays for your Part B premium only. That Part B premium is, as I said earlier, $170.10 a month in 2022. Finally, there's qualifying individual or QI1 you can qualify for. It also pays for Part B premium only. Be aware that the resource limit here, which is $8,400 as an individual or $12,600 as a couple, does not include your house and does not include your car. So your assets, if they include savings or IRAs or additional property, those are counted, but not your house and car. There's also a program called Extra Help or Low Income Subsidy. They're both the same thing. And the intention for those is to help you get paid for your prescription drug costs. In this case, Social Security makes the determination. With the Medicare Savings program, that determination comes from DSHS. So here it's actually Social Security that does it. If you qualify for an MSP, a Medicare Savings program, you're automatically qualified for Extra Help or a low income subsidy. And you can apply directly to Social Security to get it. Now here are the numbers for Extra Help. For full Extra Help, which means you'll have a zero premium for your Part D as in David plan for prescription drug coverage. As an individual, the income level is $1,549 gross per month. If you're married, $2,080 per month. So your premium is going to be zero, and you're going to have very low copays and deductibles for your prescription drugs if you get full Extra Help. The resource limit is higher than that for MSPs, $9,900 if you're an individual, $15,600 if you're a married couple. Finally, there are two levels of partial Extra Help. The difference between the levels is how much you pay for copays. In all cases, you're paying zero for your premium. But the highest level, meaning the highest payments that you're going to have to make are if your income is $1,719 as an individual or $2,309 as a couple, and your resources are either $15,510 and as a couple $30,950. Again, the resource count does not include your house or your car. MSPs, the terminology here is confusing. MSPs are considered to be Medicaid. However, in order to distinguish them, they're known as Medicare supplement plans. Medicaid means that you are very low income or you have disabilities, and you are disabled or you're 65 or older. It's covered by Medicare and Medicaid, and they cover most of your medical costs, including some limited dental and limited vision services. So I'm not sure how to say this. Our Medicaid, our official Medicaid is for those who have the lowest income and resources and provides the most coverage, but is not a Medicare Savings program because it's paid for by the states and the federal government. and whether you're eligible is determined by DSHS. And we encourage you to apply even if you're not certain that you qualify, because some of the income calculations are complicated and you may fit. Also, some of the resource calculations may allow you to participate. So again, let's talk about questions. And these can be questions about the MSPs or also Medicaid, or anything about the Medicare and preventive services that you'd like to talk about.
I have a question. Again, I'm on that Med Advantage plan, but I am paying, of course, the Part B premium. So would I then get all the Part B premium preventative services? Or is that something I need to check with?
No,
Plan.
you have to pay, in all cases, you have to pay your Part B premium, whether you're on a Medicare Advantage or whether you're on original Medicare, in order to get a zero copay for preventive services. So if I understand your question correctly, if you're on Part B, which you have to be in order to have a Medicare Advantage plan, then you're going to pay zero for your preventive services.
Yeah, that was my question, because I am, you know, we're all paying for Part B, so we should get those regardless if we're on original or Med Advantage.
Correct. Exactly. Okay. That's a good way to answer it. That's exactly right. I'm sure you have a ton of questions about Medicare. Look at you.
What I think I'll do, I'll go ahead and hit stop on recording to give folks a chance maybe to ask questions that they want to make sure aren't on that piece of things. And just a reminder that our recording